Good evening, good morning, good afternoon, depending on where you live in the world. Welcome to another episode of Chat with a Doctor and Small Businesses. If you notice over here on this side, we have three amazing businesses that we're featuring: Express Nutrition, Your Elegant Occasions, Arya Couture. And we have these lovely people. We'll introduce them afterwards, but we'll be back in 2 to 3 minutes, okay? Occasions, Arya Couture. And we have the Okay, well, welcome back, everybody. Today we have an exciting episode. We have a bunch of interesting people with us. And remember, everybody, if you want to win one of the prizes we were featuring, all you need to do is tag 10 people in the comments, in the main comments, not in the shared videos, in the main video on our website, on our Facebook page. And you tag 10 people, and then you'll be eligible to win. So, and then also remember, our show is now going to be featured on ANBtv and Assyrian TV. So just stay tuned and you'll be able to view it there or share with your friends and family there. So let's introduce our guests here. Obviously, we'll start with our Mythbusters. After that, we'll be talking to a lovely cardiologist. This guy knows everything about your heart, right? So ask him and he'll be there for you. But obviously, if you have any emergencies, you should be calling your doctor or 911. Otherwise, as number 3, we have Mr. Ninos Turnian. I think I misspelled his name, but I'm sorry, Ninos. So he's from Arseen and ANBtv. And after that, we'll have Jennifer and Michelle from Your Elegant Occasions. So first, let's do our Mythbusters. So obviously, our Mythbusters, if you go to pollev.com/RobbieEdo552, or if you're using your cell phone, it's hard for you to go back and forth between the screens. Just comment put your name or your answer in the comments, and we'll count that. Okay. Our first question of the day is this one, but let me activate it. Give me a second here. So is organic food pesticide free, right? So everybody always talks, is it pesticide free? Is it not pesticide free? Right? So it's active now. So what do you guys think? Pesticide free or not pesticide free? I have somebody said B. Anybody else from the people participating? If you don't know, just put number C or letter C, sorry. Anybody else? Nobody knows? I guess there's no. I thought this question would get more of the organic people involved in this, but okay. So let's go next. Oh, we have another B. So we're at 2 Bs. We have 3 Bs. Anybody else? Final call? Final call. Perfect. So obviously the answer, let's go back here. Oh, we have a D. Steve is a, well, Steve. Oh, Steve. Oh, Steve, you lost. Sorry. So obviously organic foods have pesticides in them. If you check the CDC, you'll see that they are allowed to have natural pesticides or small amounts of pesticides. So if you're thinking that your organic foods are pesticide free, I'm sorry, they're not. The only pesticide free that you get is actually just from your mom's backyard or your grandma, that, or maybe from IV Organic. They're the only ones maybe that are pesticide free. So yes, vague it is. And let's go to next. So next would be the 5-second rule. What do you think about the 5-second rule? Is it okay if something falls down and we eat it in 5 seconds, or it's not okay to eat things off the ground, or who knows? We have 1B. I wonder what the moms would say to this. So if something falls on the floor, do I pick it up or do I not pick it up? Okay, it looks like people are kind of confused on this one. So for this one, don't. Okay, so I got a B and I got a, so 2 Bs. Okay, so everybody's answering them correct. I should get harder questions. Oh wait, Steve has an pick it up. Steve loves this food. And then we have a don't know. Steve somehow always answers the good ones. So you shouldn't pick up anything off the floor, right? Only your child. Otherwise, it's contaminated. It depends on actually the floor, right? So the more moist the food is, the more it will pick up bacteria faster. It might take the bacteria milliseconds to get onto your food. So if your floor somehow is sterile, then go for it. Otherwise, I really doubt it. So I wouldn't try. Next, we're going to try to do some language busters, right? So we'll try to incorporate some language into this and see if people know how to speak our language or what they actually use. Our first one here is how to say rabbit in our language. So how would you say rabbit? Any guesses for rabbit? A, B, or C? I got a B, and then another B, and then I got an A. Anybody else? I'll give it a few more minutes to think about it. Is it A, B, or C? Okay, so it looks like B is the winner, but B is not true though. So B, let me bring up my slide. It's actually A. So that's a proper way of saying it. The way most people use it, actually most people on both dialects use this word. It's really actually more of a Kurdish Persian word. Somebody answered A now. Okay, so it's 50-50 now. Or more. Okay, cool. More A's now. Perfect. So now let's get on to our lovely doctor now, so he can educate us. So bring on this doctor I've known for, if I say, we might know his age. So a long, long time. Okay. So let's bring on the doc. Dr. Joseph Danavi, how are you, sir?
Good. How are you?
I'm good, man. I missed you. It's been so long.
I know. What? It's been like 2 weeks?
Yes.
Even though we've been sheltered in place.
Right? You're like one of the only people I've seen in 2 months.
Yeah. Exactly.
How are you today?
Good, good. I've been doing good. How about you?
Good, good, good. What did you think about the 5-second rule?
Those are some interesting questions you came up with first to answer. So, I mean, I'm more interested in how you came up with those questions.
I just Google it.
Okay.
Well, I'm trying to think of what people ask me
Um,
when they see me or in my clinic. I'm like, oh, wait, let's try this. So today, can you tell us a little bit about yourself and how did you get to cardiology?
yeah, of course. So, a little by myself, I've been training in medicine since 24, 25 years old. I did the medical school. I did the entire journey per se.
Yeah.
Did medical school, did training in internal medicine. And then I did a fellowship in cardiology for 3 years. And I just finished in the past summer of 2019. And then I've been now full practicing, attending now for a couple of months at a hospital in Northwest Indiana. So that's basically, my focus is preventative cardiology, but unfortunately, the majority of the patients I've seen are already in the midst of heart disease and heart failure. And, that's just the kind of aspect of things. It's actually you guys and that are the ones that should be doing this work in preventative cardiology. But, I hope that maybe our talk here, our discussion would kind of even move this to the homes, people in their own homes, kind of focusing on what they could do to prevent this really horrible disease.
And people like to hear from the cardiologist more. Better and so forth. So obviously today we wanted to try to focus on your realm with preventative factors. So my hope was, first I wanted to address blood pressure. So a lot of times people say, oh, my blood pressure is not too high. I don't have any pain. I don't feel anything. It's fine. But it's 160/90 and I'm freaking out inside and I'm trying to smile. And so what do you say to that? What do you say to people with blood pressure? Or when is blood pressure good? When is it bad? What do they feel? What are they not going to feel? And so forth.
And this all leads to the broader discussion and how dangerous disease is. It's, the problem with heart disease is that you have a very long latent period, asymptomatic period. So basically, you have a big chunk of your life, you're developing disease and you don't even know about it. And then the moment you see us, it's kind of, I don't want to say too late, but the process has already caused so much damage now to your organs that we're just trying to mitigate and trying to maybe prevent further problems. But the main issue is already, the main issue is driving the disease is already there. So yeah, blood pressure is one of the main components, one of the main driving factors of developing cardiovascular disease. But I think it's important to kind of talk, what is cardiovascular disease? We hear heart disease, cardiovascular, what is it? And so, cardiovascular disease encompasses a lot of things. So it encompasses having high blood pressure. It encompasses having coronary disease. So that's when people hear about, oh, I have blockages in my heart. I needed a stent. So things that cause heart attacks. So that encompasses that. It encompasses heart failure. So that's basically when your heart pump. Your heart is essentially a one big pump. So when it doesn't pump very well, and also strokes. So we have a huge basket of diseases that encompass cardiovascular disease. And so blood pressure is one of those main drivers of developing these diseases.
So what would be something you say at home that maybe people can eat or not eat to help them with this blood pressure issue?
Yeah, I did. So there's been a few studies that's shown what can mitigate and what could reduce or even reverse cardiovascular disease. And there's been a couple of comprehensive studies on diet, and the only ones that have shown any promising results are the Mediterranean diet and a plant-based vegan diet. And this kind of goes back to what really causes cardiovascular disease. And so I think, if I have some time, I could maybe go into trying to talk about the foundation here. So, as we know, cardiovascular disease is the leading cause of death of men and women in the world. And it's not just in our community. We have a higher rate actually in our community, in any minority community. We have higher rates of diabetes, heart disease. So basically, all the recipes of developing cardiovascular disease is more prevalent in our community. And so not only does it kill a lot of people, but it's silent, and it's causing a huge impact on our quality of life as well. You know, living with heart disease, even though if you don't die from it, is not pleasant. And so, what is the root cause of this? What causes heart disease to begin with? So the hypothesis, the kind of driving factor, is that over time, it starts even when we're young, when we're teenagers. Which it may seem such a long time for us, right? So as teenagers, what happens is you start getting layers of inflammation, fat, different cholesterol deposits, all within our blood vessels, okay? So your blood vessel starts remodeling. So it starts changing. It's not as elastic as it was before. You're getting all these deposits now of fat, cholesterol, and inflammation is kind of driving all this. And over time, all our risk factors, and I'll talk about that later, that includes blood pressure, includes our diet, kind of feed to this kind of process. And then we start developing signs and symptoms, which some of us die before we even develop any other symptoms. Our first symptom is death. That's called sudden cardiac death, when we have a massive heart attack and we don't even make it to the hospital. So I think it's really important to talk about the risk factors that drive it. And you did bring up diet, and diet is a huge risk factor. So let's talk about that. So there are. I think it's important to break up the risk factors. There's risk factors that we can change. Okay, so things that we could be responsible and try to work on addressing, and there's risk factors that unfortunately we can't do anything about. It's part of who we are as an entity, and there's nothing that we could do. It's just we're born with it, or we get it hereditary, or so these are some things that we call non-modifiable. So let's kind of talk about the non-modifiable ones, because we can't do anything about that anyways, but at least we're knowledgeable about if we have those risk factors. So one is being a man. Unfortunately, being a man, we have a higher risk of developing heart disease. So that's a driving factor, is being of the male gender. Now, women don't get off scot-free. After menopause, they start resembling the risk, the same kind of risk that a man does. So up until menopause, they're protected, but then afterwards, they start kind of catching up to us as men. Family history, if your parents, your siblings, if they have heart disease, if they have heart failure, if they have strokes, there's a good chance that dysfunction is also present in you as well. And you can't change that. And certain races, have it, and Asians in particular all have a higher risk. And so we kind of fall into that bracket. So those are things that, that you can't change, that are there, and you should just be knowledgeable about it. So now let's talk about the fun part, which you kind of addressed with the blood pressure, and you addressed with the diet, things that we could actually change. And this is not just medication. I always tell my patients when they come and see me, I get their blood pressure in control, I get their cholesterol under control, but I tell them, like, 2/3, if not 3/4 of the work is really you. You still have to address these risk factors. I can only do so much with medication, and that's just being transparent, because that's reality. That's the evidence. So what are the risk factors? Weight, okay. Physical activity, alcohol intake. Okay, so having excessive amounts of alcohol, our diet that you discussed about, blood pressure, okay, cholesterol levels, diabetes, and smoking. That's it.
It sounds like everything everybody has.
I know. I say that's it, but I mean, but it's not complicated. It's not rocket science. I wish I could. I have more patients I could see that don't have the disease, so I could stress this to, so they know. But these are what drives you into having strokes, into having heart attacks, into needing bypass surgery and stents and all that kind of stuff. Okay, and these are the processes that still continue. So even when I have patients that have stents and bypass and heart failure, I still talk to them about this stuff because the process is still there. It's I want to dispel with the myth, Robbie, that if you have heart disease and you get a stent or you get a bypass, you're good. That is not the case.
It's like
the process is still there. It's still driving it. All we're doing is putting a Band-Aid at the time. An important Band-Aid. I'm not trying to downplay stents and bypass surgery, but it's just a Band-Aid for that period of time.
Exactly.
The process is still there underneath it.
Yeah, got them there. Doc, I do have a question for you here. It says, how is COVID-19 affecting patients with heart disease, such as heart murmur? Have you seen any effects?
So, we don't know much about, even though we're a couple months in, we don't have a lot of randomized big trials to kind of determine, what the etiology of all these deaths are from. But we just know that people that have, heart disease, that have history of heart failure, that have lung disease, just any chronic ailments, they're just more susceptible to succumbing from COVID-19. There's nothing in particular I could say. We just know that people that are overall sick, they just don't do well with COVID-19.
I have a comment for you. It says, Dr. Danavi, this is very informative. Thank you.
Oh, of course. I'm glad to help in any way. Especially, I want to go back to earlier. I don't get this opportunity as much to prevent because the majority of the time when I see patients in clinic, they already have the disease, and that still doesn't mean I don't talk about these risk factors. But man, how amazing of opportunity is it if we could prevent, this disease? And so that's why I encourage my family practitioners, my internal medicine doctors to send me patients that they think are a little bit at high risk, or if they're kind of resistant to starting blood pressure medications or cholesterol medications. Because, I could and I'm all about shared decision making. This is all about putting the patient in the center and aligning with their goals. But at the same time, I think they need to get the information, knowledge,
Yeah, maybe we can just do more of these and focus on certain topics in the future. Right?
Yeah,
and we can educate people as well. I do have another question for you. It's, what do you think of Dr. Gondre's diet?
Oh man, I'm not familiar. Are you able to give me a little bit of some overview on that diet? I could just talk a little bit about why, so this idea about plant-based diets all came up from this study back in the 80s. It was it's a very interesting study. It's called the China study. And what they did was they, I'm not familiar with all the nuances of the study. I know the kind of like the spark notes, the cliff notes of the study. But essentially, I think one of the health ministers, or one of the ministers in China, was succumbing to cancer, and he wanted to have more information about what he could have done or what's causing this cancer rate in China. So they went and looked at all these different counties, all the counties in China, and they did a very amazing job of documenting their diet. And then they took that information and they transposed it on the death rates and what ailments was causing death rates in the country. And what they saw was that a high diet intake of animal foods, and that includes poultry, red meats, dairy products, they had a higher chance of having heart disease, cancers, and things like that. And so Oxford kind of got into this study, and they kind of looked at some other areas as well, and they saw the same thing in other communities. And so that's why this kind of diet this kind of approach has now gotten into more mainstream now. Is that a plant-based diet not only can prevent, but it's also shown to even reverse atherosclerosis, which is what I was talking about earlier with inflammation in the blood vessels and things like that. And so I always talk about that with my patients, especially those that have heart disease, and especially like even for myself, I'm trying to incorporate that. I'm trying to be a practicer of what I preach. So I'm also trying to incorporate that within my own diet here. It's difficult, but to be honest with you, as a culture, we are set for this.
Why?
We're set. We're set. Why? We have amazing culinary dishes for a plant-based approach. We have to fast. I mean, not we have to, but our elders definitely did. 50 days, not 40 days, but 50 days of soma. A fasting was a vegan diet, plant-based diet. So we have a lot of different variety, diversity in culinary dishes. We can do this as a community by incorporating more of our vegan dishes of soma in our regular way of living, because it really does protect us from heart disease. And if we do have heart disease, reverses. And like I talked about earlier, about the risk factors, diabetes, cholesterol levels, weight. What do you think that's all driven by? It's driven by our diet. And so this is an amazing resource. And I wish I could bottle up and put it in a pill, because I could be a trillionaire with
all our food.
With this exactly because it really could do even more of an effect that we could do with our pills and things like that. But it's so hard. So that's why as practitioners we're like, just take your blood pressure pill, take your cholesterol pill, because changing someone's diet, what a feat is that? It's so difficult to do. And people know about this. It's not like people don't know that their diet is bad. They come tell me, oh, doc, I have a bad diet, and I see them like 3-4 times, and they still tell me that. It's hard because they know what's the right thing to do, but habits are so hard.
It is difficult, but maybe we should have an episode about that as well. Just the foods, all of our different foods. We can have a cook maybe on, right?
No, so we need to bring one of our moms, that especially that adhere to the 50 day of Lent, because I remember when I was growing up, every day where we have different dishes. And now think about this. Wow, we have so many we have so much diversity within a vegan dish that, like, we should put that as a recipe book, And I'll tell you, this is not even my idea. When I was in Iraq for Gishru, I met with Ashir Qasrani. I don't know if you know him. He's an amazing, like, really down to earth, like an amazing soul. That you used to live in Canada, and is, I think, originally from England, but he's currently living in Nala, which is a villages in northern Iraq. And he was telling about this, like he wants to come up with a cookbook on our vegan plant-based diet, because that is medicine. It really is.
Yeah, that's awesome, man. So thank you very much, Doc. Just stay on board here. If somebody has any more questions for the doc, just let us know. Thank you, Doc, and we'll bring on our next guest. But just to remind everybody, remember to tag 10 people to be eligible to win. So far, nobody's eligible to win because it's just our team tagging so far. So if you want to win one of our free prizes, please tag. Thank you, Doc, and then we'll bring you on soon, okay?
Of course, anytime.
Our next guest is from San Jose. Remember, we're trying to leave Chicago a little bit, so we were able to get a very smart, nice person from San Jose. He will talk to us about his business, and it's just a very huge body shop, right? I've been to this place. It's big, full of cars and people. So let's bring on Mr. Ninos. Ninos, how are you, Dakhit?
Hi, good to be with you guys.
Good. Thank you for being on board. And I was promised I have to show this picture when you're on.
Yes.
Hold on, let's see here. So I guess your whole team is watching you.
This is the class that the time that we are a little slow, trying to make everyone that who works there to be more educated and that they can perform and the way that they're supposed to.
That's awesome. So with Mr. Ninos, I was hoping that maybe you can give us some insight about, obviously you have the two businesses, right? So maybe a little bit how you guys are coping right now with the current situation, how you're staying open, how you're helping people stay, keeping their jobs, or whatever else is happening in San Jose right now.
Robbie, just to tell you, we are lucky that our business was considered like essential, And also the businesses that we do business with them, they are essential as well. But my heart goes to those businesses that they are not essential, and they are really small businesses, and they cannot afford to close, and not making money and pay the rent. And it's really a tough time right now. But for us as essential businesses, we are trying to save and spend the money that we have cash flow very wisely, and spend them the way that we're supposed to spend. We need to be the first thing that we need to completely understand. It's not the time to panic. If any businessman that he is running his business in this situation that we are, if they panic, they will start making wrong decisions and wrong things to do, and eventually the business is going to be completely shut down. But we really at Arseen that we started this business like 30 years ago, and we started really small and not really organically. We didn't grow organically. We grow like really fast, not step by step. We started a business like 30 years ago in 1,100 square footage of small little place, but now we are operating this business in 100,000 square footage. It's like this is just the lobby that we took all the seats, all the chairs out that nobody can get close to our estimators. And we have the lobby that we have like about 4 seats. And this is if you go back to the other one, this one here, we used to have like almost 20 cars being repaired in these stalls here with all these people working. And we are almost 80% slower than before. And we try to stay in business and not close the business. And we had to almost lay off half the people that they used to work, and they need the money to stay. And this is, as you can see, it's a huge building that used to be completely packed. Like
I remember when you
couldn't find a place that to just put another car, or any tow truck driver was like, where can I park where can I drop the car? Like on top of the roof, do something, I don't know.
Yes, I remember seeing the place.
And this time, as you can see, we start painting inside whatever, outside. We are cleaning, we are doing whatever. We just keep the guys busy, because the way that our business is essential business, but not many drivers on the road, not many accidents, not many
it's good
things. But as I said, for now, we are really thankful that we didn't panic, and we are in good hands right now. Hopefully, this COVID-19, we start reopening the businesses, and the country is going to go back to normal. That was a surprise for everyone, and we have to use our experience in life to just put this one in the past.
Tell us a little bit about the A and B side. How's everything there?
I'm sorry, I didn't hear.
I said, how about going to the ANBtv side? How's everything on that side?
Is it your phone or somebody's phone?
No, it's not my phone. My phone, I put it on silent here. So can you hear me now?
Yeah.
I said, how about, it looks like you guys are keeping people safe with the body shop. How are things on the ANBtv side?
I have guys here actually working on the computers and editing stuff. Mr. Georgis is here. Mr. Benil is there.
Very good.
They're working on the computers, and I'm here in the same place with them on my corner here. Everyone, we have their own corners. We are working. We never shut down. We never push the panic button.
Good.
This is the thing that we did. Actually, if you know my business, the way that you run your own business in life is to make money, and we know this is something that we sacrifice from our own. And this TV station, it's all something that I spend lots of money to keep it alive, keep it open.
Yes. Yes.
And in this situation, it's a little harder, but again, we are here.
Tell me, so let's say we'll go back to the body shop. Let's say if I'm somebody that has a car and I need something fixed, how do you what do you want to tell people to say, look, it's safe to come into the body shop? So you showed us that things are further away from each other, so that's how you're keeping the workers safe. What would you say to the customers that say, look, don't worry, we're keeping you and your car safe? Is there anything else you want to tell the people?
Actually, we offer all the customers to go and bring the car here, do the estimate. If they want to leave it, they will leave it. If not, we're going to take it back there to the customers. We give them like so many good offers to just not to like not to drive, and personally, we don't want to be involved with so many people. Especially when the customers come to pick up the car, we make sure that we tell them, don't come here with like the whole family, just one person. And actually, I don't know if you have the pictures. We have four chairs for customers, and that's a lot. We cannot have even four of them, but we keep four in the lobby.
That's good. That's great. Awesome. So that's, I think, something that people just need to hear, that it's safe to go to these places. They shouldn't be worried about these essential businesses and shouldn't be scared to come in and take care of what they need. Like I said, in your case, obviously we need to keep our cars going. And that's
actually, to be honest with you, not many customers that we had, they're not really afraid, and they use masks when they come in.
Good.
And sometimes they tell us, why you guys don't use the mask? we get over it somehow. But that's actually this is something that I know if we use mask, it's more damaging than not to use it. It's like 65% of CO2 we are inhaling, and we don't get the pure oxygen. And especially me, someone who lives right by the ocean, on the beach, and I need more oxygen. I cannot use mask. I hate it. I don't even go to grocery because I have to use the mask. I don't want to use it.
Hey, 6 feet away, Ninos.
What's that?
Get a stick or something put around you 6 feet. Like, around your waist, so nobody can come close.
But hopefully, we are almost over this coronavirus, and we are going to reopen the country, and hopefully it will be soon.
Hopefully soon. Thank you, Ninos. And if anybody has any questions for Ninos, he'll be on, and we can ask him towards the end as well. Ninos, thank you very much for everything you guys are doing.
Thank you for having me.
And
thank you so much.
We'll bring you on towards the end. Thank you, sir.
Thank you.
So again, remember, people, our awesome fans and watchers, if you want to win some of these prizes, all you need to do is tag 10 people. So far, like I said, people are just commenting or tagging one person, so you still do have a chance. 2 of these businesses, they deliver, and they're free. You don't have to buy the hair accessories. We're buying it, we're getting it for you, so it's free. Or even the shaker cup and the mixed protein healthy snacks, right? It goes along with what the doctor was saying: healthy snacks, healthy body, healthy hearts, right? And it keeps you away from the heart doctor. So now we're going to talk to one of our business partners. They are very nice, lovely ladies. They have a small business in Chicago, and I thought to bring them on board to talk to us about flowers. So sometimes I want to buy flowers. I don't know which ones to buy. Is it red roses? I hear it's always red roses. But then what if I wanted to buy flowers for Ninos or Dr. Joseph? Like, which ones? And not red roses, right? That wouldn't be right. So what color or what type should I get for these different occasions? So let's bring on these ladies, Jennifer and Michelle. Hold on, let me do this here. Jennifer and Michelle, how are you?
Hi.
You can hear me?
How are you?
I'm good.
Yeah.
I'm good. So, not to be funny, I try to be funny, it doesn't work. But if you guys notice, they're sitting right behind their pictures. So very
Thank you.
coordination, so they knew where everybody would sit. Right? I had my picture behind me, but I took it down, so I know where to sit. Right? Social distancing. Perfect. So, ladies, how's the business going? I can't hear you.
Business is going well, a little bit
There you go.
affected, obviously because we can't continue with weddings like usual, but we are just striving with other things besides weddings, and it's keeping us.
Jennifer, maybe if you come a little bit closer, it's still. I heard something.
Can you hear us?
Yes.
You want us to show our whole faces, huh?
Okay.
There you go. That works now. That you're better now.
Okay.
So, yes, things are going well.
Awesome. That's great. I heard you guys were busy for Mother's Day. So that was a good news.
Mother's Day was
Very busy. Yeah.
very successful. Thank you everybody who helped us and supported
I
us.
can't hear you again. I think it's more Michelle's side.
Oh, maybe.
You can hear me or you can't hear me.
I can hear Michelle, but not Jennifer.
Okay.
Okay, is the speaker's closer to her?
Okay, there you go. She sat on the right side. So let's try to talk about these flowers. So obviously, guys struggle with this. Maybe some women, but they don't want to admit. Guys just think we know everything. But so, what can we talk about flowers? Like, what should I get Dr. Joseph or Ninos, for example, or if my mom or my grandma? What can you tell us?
Right. Well, the most common or the most requested flower, obviously, is the rose. So we have 6 colors that we're going to go over to kind of represent what they mean. So the first one is white. So Jenny has a white rose here. So the white represents purity and innocence, and it's usually referred to as like the bridal flower because it's associated with young love and eternal loyalty. So that would be white. Next one is yellow.
Okay.
So yellow actually had 2 different meanings. So in Victorian times, it symbolized jealousy, but now it actually represents friendship, joy, and caring. So that's probably the perfect flower to like brighten up someone's day.
So for a cardiologist, that's a good one.
That would be definitely a good one, especially like maybe a get well or if someone is like a little down.
Yes.
Peach represents sincerity and gratitude. So if you want to say thank you to someone, maybe a colleague or a friend, this would be the perfect flower. Next is pink. So there depends on the shade. We have a dark pink here or a hot pink, and that conveys appreciation or recognition. So again, that would probably be a good one for like a work environment. And light pink is usually joy and happiness.
Okay.
Another one is my favorite is the lavender. And lavender represents love at first sight. So if you have a secret crush on someone or maybe someone caught your attention, this is the perfect rose. Okay. And
Okay. So
then
if I
last,
ordered that from you guys, you'll know.
we'll know. Yeah. Well, we'll know, but we don't know if that person will know. So last but not least, of course, is the red rose. And red rose is passion, true love, romance, and desire. And it's basically the classic I love you flower. So if you're ready for commitment, that would be the flower to go with. Okay. So that's our 6 most common colors for the roses.
Perfect. Perfect. Did anybody any questions about the roses? I guess no guys are watching. All the ladies, and they know.
Now the ladies will know.
Tell me about blue.
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 Blue is usually to represent uniqueness.
Mm-hmm.
So if you want to tell someone that they're special or unique, it would be blue.
Special and unique. Okay, you got a comment. The lavender is pretty.
We got
Yes,
a message saying that they cannot hear us. Can you hear us now? I received a text message saying you cannot hear us.
it's okay. Steve will fix it.
Okay.
Steve, when he puts it
Okay.
on ANB, he'll make it louder. Or just increase the volume. It's fine. It was a little bit soft spoken, but it's fine. So let's say if I wanted to do a combination and I wanted to send it to, let's say, just a friend, what would you say for a combination? Would it be all yellow and or peach, or can I mix some of these, or is it going to look weird?
It's not gonna look weird. Absolutely.
I can't hear you.
It's not gonna look weird for sure.
Nope, still not. Technical difficulties.
Nothing at all, or something at all. Nothing.
Can you hear us at all?
I can hear you now.
Okay. I guess I have to be really close.
We have to get you a new microphone.
We'll do a GoFundMe page.
There you go. Perfect. So how about
So
a mixture of flowers? What would you recommend?
So I would recommend yellow, peach, and pink.
Yellow, peach, and pink.
Yeah, a little bit of everything.
Perfect. Awesome. Thank you very, very much, ladies. And obviously, we'll bring you back again to learn something else from you, right? And we'll try to work on your microphone.
Sorry.
We have another question about what about other flowers? Is there a specific flower you're thinking about? We can ask
What's the question?
ask about a specific flower.
Specific flower?
No, just in general. Like, is there? How about like the greens? Do you want to say anything about those? Like lilies, or
I think
just?
we can, but that's going to take a lot of time. But we can go down the list whenever you guys want.
How about just one example, and then we'll stop.
So depending on the type of flower, like if there's anything in particular, but
A
like
little bit closer.
lilies are usually used for sympathy.
Okay.
So that's definitely a flower that particular flower represents something there.
So lilies are for sympathy.
Mm-hmm.
So it's a good hospital
then-
one.
Yes.
Yeah.
Yes. Definitely good for also for a get well,
Yeah. Mm-hmm. Perfect. Well, thank you, ladies, and hopefully next time we can do it maybe at the Renew office, and we'll work on the technical difficulties. Right. So
Right,
thank
I
you very
know.
much. Let's bring in everybody on. Oh wait, what's carnation? There's a doctor that wants to ask about carnations. I guess he wants to buy flowers.
Tell him to
Okay.
call us.
Sorry, we can't see the questions.
Oh, it's hidden.
Like-
It's a private
Okay.
chat.
It's hidden. Okay.
So
What kind of question about carnation? We have some we can show.
all I have is carnation question mark.
Well,
What is
carnations
it
come
used
in many, many colors, more varieties than roses.
So what is it
Colors
used for?
of carnation. What are they used for?
What is it used for?
Carnations can be used for any occasions. We actually use carnations in weddings, funerals, sympathy, anniversary. It just depends because it's a good filler, and
Mhm.
they come in so many variety of colors,
That's a long time.
and it lasts a long
Lasts a very
time.
long time.
We like to use them for boutonnieres for the men at weddings because
Mhm.
they tend to last. And when people are hugging, when we used to be able to hug, when the gentleman would hug, it wouldn't break as fast as a rose would break. So carnations are very long lasting, and like I said, many, many, many colors of carnations.
Perfect. And I'll connect
And you can
with-
buy them.
and I'll connect you with this doctor so he can buy carnations from you.
We'll give you a discount. Let us know.
Perfect discount. Yeah, perfect. Okay, so let's bring on everybody back on here. So we have all the guests, and then we'll bring on the gifts again. So if anybody, again, anybody will be eligible to win the gifts. If anybody's interested, we'll give them another minute as we're thanking everybody. So, Doctor, thank you very much for your participation. Hopefully, we can bring you back on to do more specific topics next time to dive into them more. And Mr. Ninos, it's always lovely to see you. Hopefully, next time we talk to you, your place will be all full of cards and
Hopefully.
tell us about how business is back to normal, right? That'll be
Thank you for
great.
inviting me.
And ladies, thank you for the flower education. Maybe next time we can talk about how we can make the. Yeah, well, no, we won't do that. I can't do that. But maybe we can talk about how we can make the mixtures and stuff, right? Awesome. So thank you, everybody. It seems nobody wants to win any hair accessories or protein bars or anything. So we'll just keep them on for next time, obviously, right? So remember, this will be on ANBtv. You can't win while it's on ANBtv. It has to be now. We'll be back on Saturday and then again on Wednesday next week. Okay, so tag if you want now, and you can try to win again. So everybody, thank you very much for your participation again. It was great seeing and talking to you guys. Hopefully, we'll get to see you in person soon. Thank you and have a great day.
Shana.
Thank you.
Bye-bye.
Bye.